So cancer. This was in the New York Times a couple of weeks ago. The owner of Nike gave $2 billion to the University of Oregon to start the Knight Cancer Institute. Since the beginning of my career here, we've had wars on cancer. Death due to cancer has increased, mostly because people are older. Actually, death due to most cancers has gone down about 2%. Mammograms, prostate, colon cancer screening. Generation X experiencing larger increases in cancer incidence. Blood tests for cancer, we talked about. Artificial intelligence, they're now suggesting that the radiologist reads the mammogram and then the AI reads it the second time. AI can now predict the future risk of breast cancer from a normal mammogram. So here's the question. If the woman has a normal mammogram, but the AI sees things that we can't see, do you tell the woman that although her mammogram is normal, she has an increased risk in the next 5 years? So maybe she'll exercise more, be on a low-fat diet, and make sure she gets her mammograms every year? Or are you going to scare the daylights out of her? Mia, are you here today?
I'm here.
What do you say about that?
It's complicated, but if indeed that has potential to work for women, they might do things like go into a high risk pool and get mammograms alternating with MRI every 6 months. So potentially something to do about it, but it's complicated.
Colorectal cancer is going up, especially in young white women. New England Journal, we need better non-invasive screening. We need a better stool test and blood tests to see if anybody has colon cancer before the Cologuard or the stool turns positive. Dr. Detmer, where do we stand with some of these new tests?
So colonoscopy is still the best test, but the blood tests are good for picking up cancer, but not for preventative. And if the patient doesn't want anything, Cologuard is something to get.
Pancreatic cancer. So microRNA can predict pancreatic cancer, and supposedly, again, the AI can look at a normal MRI and tell you that the patient has a significant chance of getting pancreatic cancer in the next 10 years. Somehow the AI can see things we can't see. Large-scale pancreatic cancer detection using CT and deep learning. Probably the most important article this year, New England Journal. People with colon cancer got their chemotherapy. Half of them went into an exercise program, half of them didn't. These people who went into the exercise program had a 25% decrease in death due to colon cancer, other cancers, and everything. So that we have an exercise program for heart patients, for lung patients. We have to improve our exercise program for cancer patients. Cardio-oncology rehabilitation for cancer survivors. And again, using AI, can we predict a cancer recurrence beyond 10 years? This study shows that combining AI with artificial intelligence aided histopathology, leading to the identification of bad things. Dr. Babkowski, do you think we're going to be using AI when you look at your slides?
No, absolutely. Listen, my days as a pathologist are numbered. They are, just like with radiology. What's going to happen is, I'm going to be second read by a algorithm, and it's all image pattern analysis. But my job is going to be different because it's no longer going to be, hey, this is the kind of cancer it is. It's going to be, okay, here's the type of cancer. Here's the molecular testing we're going to do. Here's all the genetic data that you're going to get, telling the medical oncologist essentially how to modify their therapeutic options. So it's going to be data management rather than just diagnosing.